Of companies are working on a vaccine for the virus, so who gets it first? Here's News Channel 6's Atlanta Bureau Chief Archith Seshadri.
The U.S. government hopes to roll out 300 million COVID-19 vaccines by January.
And that's why testing will continue to be really important to understand who has it, who's at risk of having it, and who's at risk of getting really sick.
Doctors say the vaccine should be prioritized for the elderly, those with existing health conditions, medical workers, pregnant women, and people of color.
We're only going to accomplish that if we have widespread community buy-in, just like we did with the polio vaccine back in the 1950s, that widespread buy-in where everyone knows that this is something we have to do to keep our community safe, to keep our state safe, and to keep our nation safe from this virus.
Some groups, like the Georgia Vaccine Choice, say there could be reproductive health risks with vaccines.
Some folks who aren't necessarily anti-vaccine, but they also worry about the pace that this vaccine is being developed.
The Mayo Clinic says logistics could make the vaccinations even more complicated if people have to get multiple doses.
But I think even when vaccines are available, we're going to have to understand how they work, how effective they are, and also just have enough available for individuals, because it's quite likely you'll need multiple. It's not going to be a single vaccination, but multiple vaccines.
Doctors say 8 out of 10 people will need a vaccine to get herd immunity unless a majority of people recover through natural infection and develop antibodies.
I'm seeing folks on Facebook and social media who say, oh, there's no way I would get a vaccine. There are a lot of folks who say that they would never make their child get a vaccine. They don't believe in the mandated vaccines.
Reporting in Atlanta, Archith Seshadri, WJBF News Channel 6.
And Congress has set aside about $10 billion for the vaccine effort.